Improving Communication Between Nurses and Nonverbal Patients by me, Katherine Grilchuk. My clinical took place at the VA Hospital's ICU in Lexington, Kentucky. The VA is a federal hospital that cares specifically for veterans. This is a 13-bed unit that cares for veterans with a variety of medical needs that may require ventilation or other intensive care therapy. The VA ICU specifically cares for a large population of veterans with ALS. Veterans are twice as likely as any other population to have ALS. It's a progressive disease that affects the nervous system and weakens muscles, which impacts physical function. Eventually, patients who have ALS are unable to breathe on their own and often suffer from complications like pneumonia and require ICU treatment. This is one veteran population that is nonverbal. Other patients in the ICU are on ventilators for various reasons and are often sedated. As their condition improves, their sedation is reduced and they are alert and unable to communicate verbally while being weaned from the ventilator. Nurses at the VA I found were very compassionate and patient-focused. When I started my clinical, I was impressed at the attention and effort nurses gave to communicating with patients. But often, despite this best effort from nurses, there were still gaps in communication. Often the nurses hurried and very focused on the patient's physiological needs more than their psychological ones. During my clinicals, I observed that there were only several communication boards on the unit, and most of them were just photocopies or were cumbersome with a lot of pictures on them, like 30 to 50 pictures. I decided to do research on ways of communicating with nonverbal patients to see how I might be able to use evidence-based research to help this problem. Additionally, I had some learning goals for this course. These learning goals included effectively assess neurological and pain status for patients under sedation, identify changes of condition of ICU patients and coordinate their care with a physician on duty, and manage and appropriately titrate critical intravenous therapy drips to meet patients' medical needs. During my time in clinical, I was able to meet each goal with a variety of patients. I was paired with Tiffany Pierce, RN BSN, who was my preceptor. She oversaw all the care provided for the patients and was available for questions when needed. In my time in the ICU, I was able to manage the care of a variety of patients in the ICU. I met the first learning objective by caring for more than one patient receiving sedation on propofol drips and fentanyl drips. We used the Critical Care Pain Observation Tool, or CPOT, and the Richmond Agitation and Sedation Scale to assess the level of sedation and pain for our sedated patients. For the second learning objective, I was able to identify multiple instances where my patients experienced changes in conditions and coordinate their care with a physician on duty. In one instance, I had an ALS patient who was being treated for respiratory failure, and I noticed that his blood pressure was getting lower. We discovered that he was beginning to get an infection and experience sepsis. Our quick intervention of IV fluids and IV antibiotics ensured a positive outcome for this patient. For the third learning objective, I was able to manage many different drips while up on the ICU. I titrated and managed insulin drips, Levophed, vasopressin, propofol, and fentanyl, all with Tiffany's oversight to meet my patient's specific medical needs. In my practicum experience, I cared for and saw many other nurses caring for nonverbal patients. Whether it was related to being on a ventilator or a patient who had a tracheostomy and was on a vent for ALS, there were many patients and nurses experiencing a gap in communication. When I surveyed these nurses, they emphasized that they were often very busy and more focused on the patient's medical needs than psychological. They stated that when a patient needed to communicate, they would lip read or they would use gestures. There were two communication boards on the unit. One was a black and white photocopied paper with a few pictures on it, and the other was an old poster board with many small pictures on either side. Neither were being utilized very often. This matched the literature that I was reading. Often nurses do not have a lot of time to interact with patients and do their best, but it's not their first priority. Patients can become discouraged and frustrated with communication barriers. While lip reading and gestures are most often used for communication, they are not the most effective. Writing in communication boards or newer technology with talking devices and computers have been shown to be much more effective in improving communication. As a nurse, I know it's easy to become desensitized to ventilators and voiceless patients, especially in caring for them daily. My research showed me that patients' experience is much different. A group of patients were interviewed and asked about their experiences with being nonverbal patients in the hospital. Their accounts are emotional and can be thought of as traumatizing. One patient stated that he felt like he was missing an arm. His voice was as integral to who he was as any other part of his body. Other patients stated that their days passed on in slow motion. It made them feel powerless. One even said that he used to bang on things, that he was so frustrated that his mouth would move and nothing would come out, and that it made him very mad. He was wondering why people couldn't understand him. He thought that it was terrible and it felt like a punishment. And he got very emotional in his description of this. After reading these descriptions, I became determined to help improve communication between nurses and nonverbal patients. Evidence-based research shows that the most often used methods of communication and the communication that was being used at the VA ICU of lip reading and hand gestures have been shown to result in increased fatigue and frustration and are generally less effective in assisting the patient express their need. Effective communication has been shown to reduce the amount of time a patient stays in the ICU and is thought to assist in a patient's recovery. How could communication be improved? One of the simplest interventions that research promotes for improving communications between nonverbal patients and nurses is communication boards with pictures. In a systematic review of studies on communication methods in 2016, it found that communication boards were considered beneficial by 77.8% of patients and medical staff. In this study, the advantage of communication boards were listed to include increased efficacy, speed of communication, quicker expression of needs, and reduced frustration. With this being such an effective method for communication, I began to wonder why we weren't using communication boards in the ICU. That's when I found that the current communication boards that they had been using were either too cumbersome or too simple. My research backed this up as well. One study found that a reason tools were not being used for interventions was that they were too big, confusing, or bulky. The next barrier is that staff and patients are not provided with education on equipment or communication boards. Additionally, one of the main factors that prevents the use of communication boards is the time constraint. It just takes too long to meet the patient's needs. I know as nurses, we have all experienced the frustration of going into an isolation room, gowning up, and realizing that we don't have everything that we need in the room. And then we need to take off our gown and gloves, wash our hands, grab the item, re-gown up. This is not only frustrating, but it's also the reason why the communication boards often weren't being used. They were not in the rooms and readily available for use when needed. I decided to develop a solution to this problem. Using the communication boards that the unit had, examples from research papers, and assessing patient needs from my own experience, I created a communication board that could be used at the VA. I created the pictures myself using the computer program Paint. Then I brought these to the unit and instructed nurses on how to use the boards and how to teach patients to use the boards. The following slides show the front and the back of the communication board that I developed. This is the front of the communication board. It has pictures in color that communicate a variety of needs the patient may have. This is the back of the communication board. It has letters and numbers for the patient to use if they need to communicate something that is not shown on the other side of the board. And it also includes a pain scale and a list of the months and days for the nurses to use to assess the level of consciousness of a patient. Right now, my communication board is waiting to be approved to be laminated and placed in every room in both the ICU and the PCU of the VA. This practicum experience was an incredible learning experience for me. I'd never cared for ICU patients before and always had a desire to be able to apply my critical thinking and nursing skills to the sickest of patients. My practicum expanded my knowledge of nursing vastly and gave me a larger perspective on patients' physiological needs. Having the focus of improving communication between nurses and nonverbal patients as my project was a great way to make my practicum a well-rounded experience. While I was learning a lot about physiological needs and management of critical conditions, I was also challenged to evaluate the psychological impact of care of ICU patients and their experiences. It was very meaningful to have this experience and to leave a positive impact on the unit by creating communication boards and improving this element of care for nurses. I am very grateful for all I learned and was able to accomplish through my practicum experience in this course. Thank you so much for watching my presentation. I look forward to seeing what projects the rest of you guys worked on this semester. Like I said in my previous slide, this really was a valuable learning experience, and I've already taken and applied what I've learned in the ICU in my training to where I actually work, which is the PCU. So I hope you all had valuable experiences as well, and I look forward to graduating soon with you guys.